And now to Nigeria. The pandemic is affecting lives and livelihoods of people across Nigeria. The government of Nigeria has taken measures in a bid to reduce the rate of infection in the country. However, community-led initiatives like one led by Share Patriotic movement is getting popularity across the most populated country in Africa. We now speak to Professor Abdulfatai Jimoh, a professor of chemical engineering and also the national president of Share Patriotic movement (SPM), which is an umbrella body of youths from Share community at home and abroad. Professor Abdulfatai Jimoh, thank you for joining us.
Okay, thank you very much. Nice to have me.
What actions have been taken by Share community since Nigeria declared a lockdown across almost all states in Nigeria?
Okay, thank you very much. I want to first of all thank you for giving me this opportunity. As we all know, the index case was recorded in Nigeria February, March, thereabout. And subsequent to that, the government of Federal Republic of Nigeria quickly took some preventive steps, such as pronouncement of curfew, lockdown, etc., in order to prevent the spread or the spreading of the virus. Immediately that was done, our organization, which is the youth wing of another umbrella body, the Share Descendants Union, which is the umbrella body of all the sons and daughters of Share community in the Beledweyn local government, Kwara State. We quickly put heads together to see how we can prevent our community from having any case of coronavirus in the community. And the first step we took was to put in place a committee, a 5-month committee, to coordinate the pandemic of COVID-19 and how to prevent it in that community. Thereafter, the 5-man committee put in place another subcommittees, that is the palliative material committee and the medical committee. The function of palliative material committee is to raise, materials such as foodstuff of different varieties for the vulnerable people in the community, since the lockdown introduced by government will not give them opportunity to go out and look for what they're going to eat. And the second committee is the medical committee. The medical committee was also put in place to go around, enlighten and educate our people on what coronavirus is all about, the negative impact of coronavirus, as well as some of the preventive measures that can be introduced, that can, put in place for our people to be safe from coronavirus. I think in brief that was what we did. And in order to achieve those aims, we quickly, started a fundraising and material raising activities among the sons and daughters of that community. And I want to use this opportunity because they donated generously by giving, foodstuff material, PPE material, as well as, financial support. Yeah.
And how well are people in your state informed on coronavirus, and are the most vulnerable communities getting aid?
Okay, thank you very much. Share community, just like you have in any other places, have some other communities, very close to it, that happen to be the neighbors. Among the neighbors, to Share community in particular, we have Saraji community, we have Share Junction, we have Akpataje, and then we have the Fulani settlements. And it is our belief that there is no how we want to prevent Share community from experiencing the coronavirus without reaching out to these people. Because if coronavirus should by any means enter any of these neighborhood, then definitely Share community is not safe. So the first thing we did was to introduce an enlightenment and educational program rally, which we carry to all these other communities. And after that, we organize a seminar program where we brought together our medical practitioners, that is the medical doctors, the nurses, and then the patent stores, who sell out, medications to our people, to train them, to let them know what coronavirus is all about, as well as the negative impact of coronavirus and some of the measures that can be taken since there is no cure yet for coronavirus. During that period, during the seminar, like I mentioned earlier, the people of Share community, people of Sharaji community, people of Share Junction community, people of Akpataje community, the people of Fulani settlement, and the non-indigenous that resides in Share community participated fully. I can tell you that we have close to 200 participants at that seminar. And at the end of the seminar, we were able to give freely hand sanitizer as at that moment to every individual, every community that participated, as well as the private hospitals that also participated during that program. After that, then we introduced the palliative material for the vulnerables. The palliative, like I said earlier, involve distributing foodstuff, such as what is common in our area here. We have things like rice, beans, semovita, and some other grains. And we package it in such a way that it can reach out to about 3,000 people. And this was shared among, these areas that I mentioned earlier. I want to let you know that each of the package worth nothing less than 3,000 naira Nigerian money and reaching out to 3,000 people, meaning that we spent nothing less than 9 million naira to take care of that palliative material to the vulnerable ones.
And lastly, the World Health Organization said that the pandemic, that is COVID-19, will be with us for quite a very long time. What do you see the future holds for us and the people in your communities?
Well, thank you very much for that question. But before I go to that question, let me quickly mention that after the lockdown, if you follow the trend of things in Nigeria, you can see that at a point, just about a week or 2 weeks ago, the President of Federal Republic of Nigeria announced the ease of lockdown in some states, in Nigeria, which, also made some governors to also, did say, knowfully that because people have been restricted to their, various homes, are now introducing some kind of relief by asking them to go out in order to restore, their food stuff and get some other, necessities. Then there is every tendency that there is going to be a kind of spread, of the virus. We quickly went into action to procure PPEs for our people. And then I want to let you know that sometimes last week, we distributed over 3,000 face masks to our people. And then the suburb, communities, including Saraji, Share Junction, Akpataje, and Fulani settlement. We also gave them Veronica buckets, that is bucket with the tap, which they can use, with liquid soap to wash their hands. We gave them also waste buckets. We gave liquid soap, and we gave over 5,000 sanitizer. We distributed, like I said earlier, over 3,000 face masks, over 100 Veronica buckets, and over 100 waste buckets, in order to see how we can tame or prevent the spread, of this coronavirus during the, the relaxation of the lockdown. Now, coming to your question, that what are we, what do we intend to do subsequently? My brother, like it is known all over the world, there is no cure for this virus yet, and nobody knows when there's going to be, an end to this pandemic. We therefore, working, hand in hand with our people, that is people who contributed, generously towards, the organization achieving this, to see how we can repeat what we have done to our people in terms of giving them more palliative materials, so that nobody, will suffer lack of, food stuff, food materials, and the basic, PPEs such as face mask, hand sanitizer, and some other stuff. Then I want to let you know that in that community and the suburb, the enlightenment program, the educational rally is ongoing on daily basis, so as to let people know that coronavirus is real, coronavirus is our enemy, and we should try as much as possible to stay at home, to stop the spread, and to save life. I think that those are the things we are planning for the next stage of our actions against this world enemy, coronavirus.
Thank you very much, Professor. And that was Professor Abdulfatai Jimoh, a Professor of Chemical Engineering and also the National President of Share Patriotic Movement.